Welcome to a new episode of Mind Matters with Manoshanti. I'm Manasi, your host. I work as a family and couples therapist at Manoshanti, Bangalore. And today we are going to be speaking about Alzheimer's disease. A few of you may know that September 21st is celebrated as World Alzheimer's Day every year. And this year, the theme is Ask About Alzheimer's. So, today, to speak and to discuss about this subject, we have with us a special guest, Dr. Rishikesh Behere. Dr. Behere is the founder and medical director of Manoshanti, and he founded it in 2016. A very brief introduction about Dr. Behere, because if I were to mention all accolades and awards, then we will run short of time. So, Dr. Rishikesh did his MD in psychiatry from NIMHANS, which is a premier institute of mental health in India. Following that, he was a faculty at KMC Manipal, and he taught psychiatry over there. He treats all kinds of mental disorders, but he has received special recognition from Royal College of Psychiatry, UK, for developing a screening tool for Alzheimer's disease and dementia in India. So I welcome you, Dr. Behere, to the podcast.
Yeah, thank you, Mansi, for inviting me and having me over on this podcast. And hope we have a useful conversation, which would be of benefit to the listeners.
Right. So I'll jump right into the question. So, could you briefly explain what Alzheimer's disease is and how is it different from normal memory problems or just getting older?
Yeah, so Alzheimer's disease is a condition which we call as a neurodegenerative condition. Okay, so
Hmm.
which means that there's a degeneration of the brain, or in simple layman's term, we can say that the brain shrinks, or what we call as atrophy over a period of time. And this
Hmm.
happens in specific areas of the brain which are related to memory functions. And so this is a clinical condition which we call as dementia.
Hmm.
But in normal aging also there is some kind of a degeneration, or like for example, when you're getting older, we all know that our muscles kind of lose their bulk, or they become weaker. So a similar
Hmm.
process happens wherein a brain also shrinks and loses its ability. So that can happen as a process of normal aging. But when it
Hmm.
happens at a far greater rate than what
Right.
is expected for normal aging. Okay, and when it also affects brain functions more than memory.
Right.
So that whole clinical syndrome forms what we call clinically as dementia.
Right, right. I mean, this is important because most people assume that it is just memory related, but then apparently there are other functions that are also impacted. Now, this is a very important question because a lot of us forget things occasionally. So, how can someone tell the difference between normal forgetfulness and early signs of Alzheimer's?
Yeah, so forgetfulness is something which is quite common, and with age also it can happen. So what happens in normal forgetfulness is that so many times suddenly at that point of time we don't remember a fact.
Hmm.
Uh, yeah, but many times we are able to recollect it at a later point. And forgetting that or not recollecting that at that point doesn't really cause any dysfunction in your day-to-day life.
Right.
Right. But in dementia, what happens is that there are memory gaps that are formed. So there are certain actual events or which don't get registered, or those memories don't get formed. Like for example, people with
Hmm.
dementia may forget that they have brushed their teeth in the morning, or they may forget what they had for breakfast, or that they have actually had breakfast, and they end up asking again and again that, okay, you didn't give me breakfast, I haven't eaten today. So there are like
Hmm.
those very obvious memory gaps that get formed.
Right.
Plus, along with that, it also starts affecting their uh, different functions that you require for your day-to-day activities. Like, for example, you may lose certain skills that you have learned. For example,
Hmm.
a homemaker who has been cooking all her life, you may start forgetting how to make sambar, or how to make a particular dish that
Right.
she's good at. May forget,
Right.
some of those are early signs that people recollect that she used to cook very
Right.
well till now, but of late there's something obviously wrong.
Yeah.
Right. So,
Yeah.
and plus they also start losing skills. Like, for example, they may forget how to use a remote. They may forget
Hmm.
how to use a mobile phone. They may start losing sense of direction. Typically, somebody went for an evening walk and then suddenly did not
Hmm.
remember how to get back home. They got confused. So these are some early signs. So it starts impacting your day-to-day life, okay,
Like,
which does not
right.
happen in normal age.
Right. Yeah, so me forgetting my glasses or where I've kept them is probably not an early sign. So
Of course not.
that's important to understand. And at what age does Alzheimer's typically start showing? And could younger people also sometimes get it, or is it typically only older people who are affected?
Yeah, so typically, Alzheimer's dementia is known to start after the age of 65. And
Hmm.
1 in 15 people at this age can show signs of dementia. And the
Hmm.
risk goes on increasing with age, such that at the age of 85, almost 1 in 5 people may have signs of
Right.
dementia. So nowadays, life expectancy has increased.
In.
Yeah, so there are more and more people living up to the ages of 80s and 90s. So that's why we are nowadays seeing an increase in the incidence and prevalence of dementia. It is becoming more common. There's also a variant of dementia, which is called as young onset dementia. So typically,
Hmm.
this occurs at the age of 40, but it's a very rare condition, and sometimes it can happen when there is a genetic risk for dementia. So usually we see it at the age of
Hmm.
40.
Hmm.
Yeah. So I think recently there was a movie called Sayara where the female protagonist is
Okay.
shown to have young onset dementia. In that, I think
Right.
she's in a very early 20s, but that's not typically the age where we
Right.
would see dementia. Why when we say early onset dementia, it's usually at the in the 40s.
In the 40s. All right.
Yeah,
All
but
right.
again, I'd like to emphasize that it is quite rare.
Yeah, yeah, okay. Um, so you also mentioned a few risk factors, or you mentioned something about genetics. So I'll come back to that later. But before that, I'd like to know. So when you go to a doctor, how might a diagnosis typically happen? Do they do some tests, or do you simply ask questions and then based off of that, do you diagnose it? How is it diagnosed?
Yeah, so anybody who is above the age of 60 and is experiencing difficulties in memory, so mainly memory gaps, not being able to remember certain information, so
Hmm.
they should seek out help to get this diagnosed early because early detection is important. So the way it is diagnosed is that the clinician would take a detailed
Hmm.
history and evaluate for your signs and symptoms. And also, they would look at to perform a cognitive screening test with you to examine your cognitive functions. So the brain has different areas, and each area of the brain has different functions. So the
Functions.
cognitive screening test will test your basic functions in different brain areas to see whether any of those are impaired more than what they should be. And
Hmm.
these are scientifically designed and validated tests, which will tell us if you score below a certain cutoff, that there is a chance of dementia, which needs to be investigated further. Plus, additionally, there are brain imaging scans that can be
Hmm.
done, which shows us what is the level of atrophy of the brain.
Brain.
There are also techniques nowadays by which we can measure different brain areas and which will tell us the size of the different areas and then which will tell us compared to expected normal, how is there significant atrophy of the brain that has happened.
Oh, okay.
And yeah, there are also some specialized brain scan which measures changes in the blood flow in the brain and by which we can see whether any specific brain areas which are associated with memory, whether there is a decline in their blood flow, which gives us an
Hmm.
indication
Hmm.
of whether there is a dementia process setting in.
Right.
Plus, we also do certain blood tests to rule out what are called as reversible causes of dementia. So sometimes
Hmm.
dementia-like symptoms can happen if somebody has thyroid issues or somebody
Right.
has vitamin deficiencies such as a B12 deficiency. So we
Hmm.
also do certain blood tests to rule out that there are no reversible causes of dementia. And the
Hmm.
blood test also will tell us about certain risk factors. So if somebody has uncontrolled diabetes,
Hmm.
for example, that becomes a risk factor for dementia. So blood test will also tell us whether the person has a good control over their diabetes, and that would help us in the
Oh.
management as well.
Right. So I think this is there's comprehensive there's a comprehensive diagnostic process. It's not just one or two things based off which experts diagnose dementia. And before anyone jumps to a conclusion that somebody known to them who's of that age, because of forgetfulness has dementia. I think all of these, because there's reversible factors also. So that is very, very helpful to know. Um, right. And what how is it helpful to really get an early diagnosis in dementia?
Yeah. Because dementia, as I mentioned, that it's a neurodegenerative condition, right? So as
Hmm.
opposed to, maybe say, for example, you have a cut on your skin and then, those cells have an ability to regenerate
Heal.
and that can heal. But in the brain, what happens is that the atrophy that has happened is not, is irreversible,
Right.
right? So the only way right now we have is early detection by which we can
Right.
catch the onset of the disease early and maybe start some. There are treatments which can, medication that can help to retard the process of the atrophy,
Right.
right? So if it is detected late and something is already lost, there's no way for us to recover that. But if we
Regain it.
detect it early, we can try and start intervening so that the progression of the disease can be slowed down. So
Right.
that's why it's very
Right.
important that we detect this early and treat it and catch it early.
All right. So again, you've already touched up a little bit upon treatment and all, and I'll come to all of that. But before that, we come to the risk factors because that is something that you mentioned earlier. So what, and a lot of us are interested in knowing what is the root cause. Most of us want to know why it happens. So what causes Alzheimer's disease?
Yeah, so Alzheimer's disease is it's a mix of it's multifactorial. You can't really pinpoint it to a single cause.
Okay.
So there are some genetic factors. So some people have a susceptibility genes
Hmm.
for this because and plus, but it's only having the genes is not enough. You also need a bad environment that you give to your brain. So the bad
Hmm.
environment includes, if somebody has diabetes and they are not controlling it, and there's uncontrolled diabetes, that's a very big risk factor. If somebody has hypertension and that is not controlled, they're not taking
Right.
enough care about it, neglected.
Right.
So that is an additional factor. Then somebody has a poor lifestyle in terms of if they have alcohol use,
Hmm.
alcohol dependence, and they're misusing alcohol or smoking. So that can increase the risk. If somebody has a high lipid profile, they have high cholesterol levels, that over a period of time can also become a risk factor. Plus, along with
Right.
that is the kind of lifestyle
Hmm.
that you have. People generally who are more social, adaptable, or who have work are active uh, in terms of their work, or are actively engaged, engage their
Right.
mind in productive activities longer
Mhm.
for longer periods of time. So such people usually have it is said to be protective
Okay.
against dementia. And
Right.
yeah, so these are some factors that can cause dementia, and there are certain factors that can be protective against it.
Right. So when you said what you said looks to me like there's factors that are risk factors that are modifiable, and then there are risk factors that are non-modifiable. So clearly, we can't do much about the non-modifiable risk factors, which is the genetic component of it. But the modifiable risk factors seem pretty much anything that anybody should do, even otherwise. Even if it didn't carry a risk for dementia, it has other risks like controlling hypertension, diabetes, and such. Okay, and you briefly touched upon preventive measures, which is being adaptable, being social. Anything else that you can think of which can help prevent dementia?
Yes, also it has been seen that people, elderly people who have depression, or
Huh,
those who are, loneliness nowadays is a big factor.
it is. It
Right?
is.
That has been identified as something that is going to become an epidemic going
Right.
forward. So that, I mean, these factors have also been found to contribute to dementia. Plus,
Hmm.
some additional protective factors. I mean, there's some research which has said that learning new languages has been
Okay.
found to be protective
Right.
uh, against it. And in generally, people who are more active and productive, engaged in productive mental activities for longer periods
Hmm.
of time.
Hmm.
So, for example, people who typically will, maybe if they retire after the age of 60 and 65, and then do not continue to lead an active lifestyle,
Hmm.
post that age.
Hmm.
So they run a slightly higher risk of having dementia later compared to somebody who continues to be uh, engaging in an active lifestyle.
Right. Sounds a lot like if you don't use it, you lose it. So the abilities that you keep using, if you keep using your cognitive abilities and your brain functions, even later into later life, then that helps preserve cognitive functions.
Yeah,
Um,
so just here, I would just also like to point that there's a concept called as cognitive reserve.
hmm.
Yeah, so which says that so everybody has certain abilities of their brain, and so while there are certain regions of the brain which perform certain functions, but the brain also has the ability that other unrelated areas also, if they are kind of active and well connected
Hmm.
regions of the brain, they can take over activities of the other parts of the brain.
Oh, okay.
Right. So even if you're losing your memory, for example, in somehow you're losing some brain function certain, but if you have a good cognitive reserve
Right. That
that
might help.
can that can help compensate, and you may not have very or at least reduce the intensity of the symptoms even if you were to develop dementia. So it's important to build that cognitive
Huh.
reserve in that.
So how does one build the cognitive reserve?
Yeah, so that can happen by engaging yourself in an active lifestyle,
More and
giving
more.
more activities
Yeah.
to your brain. So that's in that context, that's where learning new languages has been found to be this thing. So
More
I
effective.
mean, preserving that curiosity to learn,
Right.
go on learning new things. Like, for
Hmm.
example, somebody who's 65 now may be exposed to, these new AI concepts which are coming in,
Hmm.
right?
Yeah.
So that interest to kind of continue to engage in whatever is happening new and not giving up that, okay, I'm old now, so I don't need to know this,
Right. Right.
right? So basically,
Right. That's
continuing to have that interest and curiosity keeps your brain active.
keeps your brain active. Right. Right. That's pretty useful. So now we come to the treatment part of it. Is there a cure? And by cure, I mean, okay, so somebody got diagnosed with it and then you gave medications and then it completely disappeared. The symptoms completely went away. So, is there a cure for dementia currently?
Yeah, I mean, unfortunately, I mean, we don't have a cure for dementia
Hmm.
currently because it's a degenerative process. So what is
Disease.
lost is lost. The best we can do right now is catch it early and try and retard the progression as far as possible and improve the quality of life of the individual who has
Mm-hmm.
dementia. Right.
Hmm. Hmm.
So once we identify it, so we initiate treatment for it. So these are cholinesterase inhibitors, which are drugs which are used to retard the progression of the dementia.
Okay.
Along with that, if somebody has diabetes, having strict control on the diabetes, somebody has hypertension, strict control on the hypertension, ensuring that you have taking adequate vitamin supplements that
Supplement.
your brain needs, giving the brain the nutrition that it requires.
Hmm.
Right. Recently, there are certain antibody against the proteins or so there's something called as tau bodies and beta amyloid that gets produced in the brain that has been
Hmm.
found to be responsible for dementia. So there are antibodies against this which have been recently come up in development, and there's certain antibodies which have been recently approved by the US FDA as a
Okay.
treatment for dementia and have been shown to retard progression. So these are some
Right.
newer treatments that are coming up, not yet available in India, and a lot of it is still in the research stage. But going down the line, maybe hopefully we will have some better treatments.
Right, right. And generally, when somebody says there's no cure, I think it sort of feels like it spells doomsday. But I'd like to point out that a lot of non-communicable diseases and lifestyle diseases don't necessarily have a cure, but people are still able to live, useful, productive lives if they address whatever can actually be addressed. So that is one thing that I would really like to point out. So it isn't that just because there is no cure. It doesn't mean that it has to be, a completely gloomy picture. That's
Yeah,
one.
but
And of course, yeah,
yeah,
yes,
but
sir.
when you talk about dementia, more than productivity, what we are focusing on is the quality of life of the
Right,
individual.
right. And there's research that's ongoing. So hopefully we will have, better treatments down the line. Right. Now, it's evident that when somebody is impacted by dementia, it's not just them, it's their family who will also be impacted by it. And how do family members make sure if to support somebody who has dementia? And what are the simple things that can improve the life of a person who has dementia?
Yeah, so as I mentioned, quality of life is important. So that is where if role of the family comes in to try and give them as much a better quality of life that they can. What also happens in dementia is that when dementia is early, so the individual themselves also realize that they are losing memory.
Right.
Okay, and that is somewhere that is also a sign that I'm losing my capacity and I'm
Yeah.
nearing my end. So that kind of that kind of a thought process can also trigger depression uh,
Right.
in them. Once dementia progresses, maybe they don't realize about the memory loss, but when dementia is
Early
early and they still
stages.
have that mental faculties intact to understand what is happening, so that is where they can also have a depression. So that's where the support of the family becomes important. As the
Hmm.
disease progresses, what can also happen is that they can develop certain complications, which we call as neuropsychiatric complications. So
Okay.
so they can develop hallucinations and delusions.
Hmm.
Okay, so they can start seeing things that are not there. They can hear voices
Hmm.
of people that are not there. Typically, they can start. They may start saying that some relative or somebody who has expired many years ago is not there, but they say that that person is still there. They can see them, they can
Hmm.
hear them. People with dementia have such experiences. They may have they develop delusions that somebody is trying to steal their property or their money, and as a result of that, they can start becoming aggressive. There can be a change in their
Right.
behavior. So people with dementia can also become where there can be a change in their mood wherein they start to get very irritable.
Hmm.
Another common thing that happens is they start losing sleep. They don't sleep well at night,
Hmm.
and so then that can become problematic for the family members
Right.
who take care of them. So these are certain complications that can arise. There can also be a personality change
Right.
that happens. They can become adamant. They
Hmm.
can become stubborn, not listen to instructions. So overall, I mean, if you have to look at it, it's like that Benjamin Button movie wherein there is a regression in their
Yeah.
uh, so it's more like they start becoming more childlike.
Childlike.
Right?
Yeah.
So one useful principle for relatives to observe is that people with dementia need to be treated the same way as you would treat a child,
Hmm.
right? Because a lot of their
Hmm.
functions when they regress are like childlike. So
Right.
so it's also some simple things to basic principles to remember is that people with dementia need a very structured lifestyle.
Day
So their
routine.
day should be very routine, should be structured, and the same thing should happen every day at the same time.
Hmm.
So the time that they wake up, the time that they get tea, the time they have breakfast, the time they come out to so I have a structure wherein there are very specific activities that they will do at certain times.
Hmm.
Okay, so
Hmm.
have your tea, and then or the same time they go for their bath, and then they come out, sit at the hall, watch some TV, listen to some music, or somebody's reading out a newspaper to them.
Hmm.
And what time do they have lunch? What time do they rest in the afternoon? What time do they maybe go down and have a walk in the evening? So
Hmm.
that whole routine should be structured. So when the same thing is done every day, they fall into that routine, and then managing that is much easier.
Easier.
Second
Hmm.
thing is family members should remember that do not try to test their memory.
Hmm.
Yeah, so there can
Yeah.
be a tendency, do you remember this? Do you remember that? So it can be taxing on the individual, and it doesn't really serve any purpose.
Purpose. Yeah.
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 And yeah, so avoid that. And as I said that, in early stages, people maybe have that awareness and it makes them more, it can induce depression,
Hmm. Hmm.
right? So that having the structure is important. The other thing, what is important is reducing too much stimulation. So people with
Hmm.
dementia don't do well with too much stimulation, the too much
Hmm.
sound,
Hmm.
too many people coming and visiting them every day. So, that can make them disoriented, and confused. Having too much
Hmm.
clutter in their room where they stay.
Hmm.
So those things
Right.
need to be avoided. Then we also need to what we call as reorientation strategies. So
Right.
have a big calendar in their room wherein they can see what is today's date and what is today's day. Have a big clock
Right.
where they can easily refer and see what is the
Mm-hmm.
time. Have a calendar or a timetable kind of activity schedule in their room so that they know that okay, what is the time and at what time what activity they are expected
Right.
to do. Having clear signs in the room that where is the bathroom, where is the hall.
Hmm.
Okay, because sometimes because of their they get confused about directions and
Right.
so those things can be taken care of by
Hmm.
this. Plus, you should also have enough supports in the room. For example, have a rod or a stand near the bed wherein they can hold and get up.
Hmm. Hmm.
Have a in their washroom have railings where they can take support,
Right.
right? Because falls is something that commonly happens in dementia and
Commonly
that increases the morbidity and so that is something that needs to be avoided.
avoided. Right. Right. So to briefly summarize, a structure is important to their day. They become more and more childlike, and therefore a routine is very important. Do not test their memory because it doesn't serve a purpose. Avoid too much stimulation. Keep the space clutter free. Reorientation strategies by having calendars and clocks and an activity schedule. Signs in the room for them to remember which direction what is in their room, avoiding falls by having adequate supports and all of that. And I'm certain that there are many other small, useful strategies that people can use. So
Yeah,
this
one
is
other
this.
thing is, yeah,
Hmm.
one more thing is that, because as I said, that there can be a personality change, they can become adamant and stubborn. Yeah, so
Hmm.
sometimes giving them very clear direction, not being confrontational,
Right,
right? So just accept so they're giving, if they are being difficult, just give them, let them be, just give them a little time, being
right,
patient with them. So that is
hmm.
also important for caregivers to remember.
Right, right. Um, this was very, very useful. But this also brings me to the next point that this sounds like a full-time job for caregivers, and it sounds like it would also put a lot of stress on the primary caregiver of the person with dementia. So, and stress can obviously cause mental health concerns in the caregiver themselves. What are some practical tips that you would give to caregivers to sort of maintain their own mental health?
Yeah, so being a caregiver to a person with dementia is not easy. And, as you
Uh,
said, that it takes a toll on the caregivers as well.
yeah.
Because they have to kind of on a day-to-day basis ensure that so many things are
Hmm.
happening on time. As some getting them to do the things can be challenging. So over
Hmm.
a period of time, and sometimes they're not sleeping at night, and you also lose your sleep.
Yeah.
That can be challenging. So some things important are is that once you have somebody in your family who's diagnosed with dementia, it's important for all the family members to kind of sit down and divide responsibilities
Hmm. Hmm.
among them. So as they say, that it takes a village to raise a child.
Leave a child. Yeah.
Yes, yeah, so it's something like that. So it's not easy it's not a job of only one person. So you
Person.
will need help.
Support. Yeah.
Yeah, so family members dividing responsibilities among them, making sure that not one the burden does not fall on one particular family
Hmm.
member. Uh, so even if sleep is a concern, so taking turns so that not one person is bearing the brunt
Hmm. Hmm.
of it, and so ensuring that they do get time off so that they can recover their
Hmm.
sleep. Uh, Nowadays, I mean, it's possible, you do get house helps and trained attendants and nurses. So employing
Hmm.
somebody like that who can come and help with the daily chores or be somebody who can be there at night.
Hmm.
So that a lot of families are now doing. And
Hmm.
so if they
Hmm.
have the resources for it, that would be a good idea.
Hmm.
Right?
Hmm. Hmm.
If they don't have the resources, then having engaging more family members and dividing responsibility is important. And it's also,
Hmm.
and a lot of many times when family members also have to come to the term that you have an affection for this individual. You've seen them so productive, for so many years, and seeing them deteriorate, and having to be dependent on you for even basic functions. So that's something which can take a toll mentally on the caregivers. So
Hmm. Hmm.
if a caregiver is facing, that mental strain or burden, it's a good idea for them to seek psychological support and
Hmm.
therapy to, kind of help them deal with their own emotions. So that's why they also need to be cognizant of their own mental health during this caregiving process.
Right. Right. Um, I am not certain as to how much social stigma or disease. Like I know most mental illnesses do carry a lot of social stigma, but how much social stigma do you think Alzheimer's carries? If it does, why do you think that is? And in your practice, have you come across, examples where something like that has happened? And how can we work as a society to create a more supportive environment for people living with the disease? So,
A lot of the stigma, and I think, is because of lack of awareness that
hmm,
certain, that dementia is a condition, and it's a clinical condition which needs to be diagnosed and treated early. So sometimes people are aware of memory problems, which they equate to dementia,
hmm,
but as I said, that dementia is not only about memory. It's also about, there's a change in your personality, there's a change in behavior, and sometimes that is the
hmm,
early sign which precedes the memory loss.
hmm,
So you observe a person who's in early dementia but is behaving differently, is
yeah,
maybe getting more irritable or more adamant than usual, or may sometimes engage in behaviors which may not be socially appropriate. So those are the kinds of things that
yeah,
cause stigma. So it's important for people to understand that dementia is an illness which needs to be diagnosed
hmm,
early and treated. So I think awareness is the key.
hmm, hmm,
Yeah. And so spreading the message of what is dementia, and what are its symptoms, and how it is a condition. I think spreading that message is important.
right. Right. So awareness goes a long way in sort of making people understand that it's a disease, and therefore some of the socially awkward behaviors that people with dementia may indulge in can sort of people may understand that it's because of a disease. All right. Now, if somebody suspects that their family member is showing some signs of Alzheimer's, what is the very first step that you recommend they take?
Yeah. So the as we discussed, that early detection is very
Hmm.
important, right? So if you do suspect, or you see some signs or some memory problems in a family member, an elderly family member, I think the immediate first step should be to get a professional help.
Help.
So it could be, yeah, it could be a psychiatrist, or it could be a
Hmm.
neurologist who can evaluate, and who can do a cognitive screening to see whether there is any decline in the cognitive functions, and do a proper evaluation,
Hmm.
and then carry out the tests that are required.
Right. So consulting a medical professional, a psychiatrist or a neurologist is the first step that you would take, you would suggest that people should take. So, sir, it's clear now with your response that, if somebody suspects that either they or somebody in their family is starting to show early signs, who they should go to. So you say that it should be either a psychiatrist or a neurologist for a proper diagnosis and evaluation. Now, once it is diagnosed, my understanding is it's a long-term illness. So, what and you've also mentioned that there are different kinds of symptoms that occur as the disease progresses. So, for that, who would be the ideal medical professional to see in terms of long-term management of dementia and its symptoms?
Yeah, so in the long term dementia, as it progresses, there are multiple symptoms that can develop. So it requires a multidisciplinary approach. So the role of
Hmm,
psychiatrist comes in, where there are people with dementia can develop sleep disturbances, they can have mood disturbances, aggression, or they can have
hmm,
hallucinations and delusions.
hmm,
And yeah, so when there are such changes, that requires the expert guidance of a psychiatrist to manage those symptoms. Plus, along with that, there's also important role of psychologists and psychiatric social workers to help families to cope with the
Hmm.
condition, to train them to help the reorientation strategies that need to be implemented. As we
Hmm.
discussed, the caregivers themselves can have psychological burden or distress because of
Burnout.
burnout
Hmm.
because of that. So that requires psychological support. So it is going to be a multidisciplinary approach. Plus, along with that, nowadays there is a recent scientific evidence that there are brain stimulation techniques that can help in early stages of dementia, what we call as mild cognitive impairment. So there are
Ah,
brain
okay.
stimulation techniques such as RTMS or TDCS, for which evidence is emerging. So
Hmm.
that is another area where psychiatrist role comes in management of dementia.
Right, right. This is really helpful because I think a lot of times people can get confused as to who would be the appropriate doctor to address these problems. And so a psychiatrist and allied professionals in order to manage the long-term symptoms of dementia. Okay. This was very useful. And finally, is there a message of hope that you would like to, or some advice that you would like to give our viewers uh, on this topic?
I think the important message is awareness, that because the only tool that we have right now against this condition is early
Hmm.
detection. Right.
Hmm.
So to be vigilant and to be aware about this condition and its signs and symptoms, so that elderly people in your vicinity or in your immediate family, you can kind of take the right steps for them, detect this early, and take the steps that are required to improve their quality of life. Be prepared. Right.
Hmm.
So
Hmm.
so that is something that is going to be important, because once the dementia sets in, there are not only medical challenges, but there are a lot of also other social challenges. For example, the person may not be able to operate the bank account, for example.
Yeah.
There may be their properties, if a will has not been made.
Made.
So most legal experts will advise that, even if that you make your will early, so that even tomorrow, if you are going to have dementia or any such problems, then you can sort out these kinds of problems, because they can impact socially in them and create discord within families, which then in turn impacts the caregiving abilities for the person with
Right.
dementia. So these things are important. So the message that I would really like to give is awareness, to spread awareness about dementia, and second is that early detection is the key, and so get a cognitive screening if you suspect this any kind of impairment in their brain functions in any of your
Hmm.
elderly relatives.
Right. Right. So, so you're saying basically be a little more proactive. If you find signs and symptoms, go consult a professional so that you know. And if there's early detection, then that is always helpful, because otherwise there are, and I think there are a lot of problems that you mentioned that people realize only once the disease has struck. For example, these practical bank related difficulties and stuff like that. I don't think we actually take them into account because it's you don't realize how much all of that will be impacted once a disease is already progressed. So early detection, and for that awareness and being a little more proactive. So that is the message. All right. Thank you so much, Dr. Behere, for sharing such valuable insights with us today. I think it is very clear that Alzheimer's is not just occasional forgetfulness. It is a very it affects the brain in profound ways, and not just the person living with it, but also the family members. So I think this was a wonderful discussion, and thank you so much.
Yeah. Thank you, Mansi, for having me. And I hope that with this conversation, we are able to do our little bit in spreading awareness about dementia.
Yeah, I hope so too, sir. Well, I'll see all of you with another episode of Mind Matters with Manoshanti very soon. Until then, goodbye.
Thank you.